We'll walk through our 3 pillars of the building.
A simple visit by Navy Bureau of Medicine leaders.
So this is downtown Laverne, Minnesota.
To Sanford Health's virtual care center in Sioux Falls.
This is why we're so passionate about closing gaps in rural health care.
Is leading to an immersive experience.
And trying to continue to determine how and when we can be the premier education and training center for clinicians within the United States as well.
Everything that's been demonstrated and shown between the virtual care center.
This has been extremely vital in keeping our patients in their home communities.
The emphasis on reaching these communities.
So our innovation space
has been fantastic.
Have you guys done VR before?
Lieutenant Grant Hungerford, originally from rural Minnesota, serves as a nursing professional at Navy Medicine Readiness and Training Command in Portsmouth, Virginia.
There you go.
We really enjoyed our time in the VR room.
Pretend you're not walking through the furniture.
We got to experience some VR simulations to go through some judgment and clinical practice models there, which has been really great.
He's actually physically right next to you.
Welcome.
And of course, touring the simulation trucks was a lot of fun too.
They're high fidelity mannequins, so they breathe, talk.
Sanford Director of Simulation and Pre-Hospital Care, Travis Spier, is walking the sailors through a variety of spaces the organization uses to educate caregivers all over Sanford's footprint.
We actually travel throughout the Midwest, supporting Sanford and non-Sanford facilities doing clinical education. I think it's important. It provides individuals that are in clinical situations or clinical roles in that military environment to tap into the specialty care that Sanford provides.
Providing access to care in rural communities is close to Hungerford's heart.
It's still an area that desperately needs the virtual touch to expand access to care out there. Otherwise, it's still a frontier that hasn't got a lot of resources available to them.
Making sure resources are available to military members is another priority at Sanford.
Kind of a hallmark of the commitment, to support anybody that's willing to serve our nation and protect our nation.
Head of Military and Veteran Affairs, Paul Weckman, a retired Navy captain, says the organization wants to hire, care for, and work with our military members and veterans.
Here's an opportunity to showcase what we do here at Sanford, and maybe the Navy will take a look at this and also want to come and maybe again have a partnership with us as well.
Collaboration already underway with local airmen.
So we worked with the South Dakota Air National Guard, providing on-site education as well as clinical immersions into the hospital environment. We've also been on base and actually provided education and hands-on opportunities for about 400 of their aviators and staff that support the base.
And any time we can support any of the military branches to increase readiness, Sanford is always going to be there.
We'll let them call a timeout, more for an educational perspective, and then we'll walk them through
training that leads to experience and better outcomes for patients in the Midwest and beyond.
Once they've answered those particular questions, we'll reactivate the scenario.
With Sanford Health News, I'm Matt Holson.
We don't want them to proceed and practice incorrectly. We want them to do it correctly from the get-go.